Hi everybody in Mrs. Brennan's class. My name is Melissa Herlihy. I am going to be teaching you today about Stop the Bleed. Mrs. Brennan has invited me to present this course content to you. There's a slideshow that I'll be narrating for you. And then in a second session, I'll be talking about careers in healthcare. So I look forward to, I thank you for your questions, and I'll get started. Welcome to Stop the Bleed. This is a program that aims to teach lay professionals how to identify and control life-threatening hemorrhage. There's a number of different organizations that have worked together to develop and promote these techniques. They're listed here. This program grew out of the Sandy Hook shootings. After that tragedy, a number of people got together and looked at what caused what the cause of death was for these children and the people who died there. And it was found that a number of them died from injuries that weren't so life-threatening, but they hemorrhaged. And if there had been somebody who could have stopped that hemorrhage, a lot of the death could have been prevented. There are a couple of images during this show that show pretend injuries. So just so you're aware, there is something that looks like an injury in at least one of these slides. It's not a real injury, but it does look like one. The number one cause of preventable death after injury is bleeding. So if we have people in the general public who know how to stop bleeding, we're going to be able to prevent deaths. You can use this training anywhere. Just as there are people having heart attacks and people doing CPR anywhere in the world, in any setting, also the use of AED. This is similar to that. The person who is best able to act quickly is the person who's standing right next to you. They get there much earlier and can intervene much earlier than waiting for paramedics or other rescue people to arrive. This is not just a technique that can be used for violent injuries. People can suffer life-threatening illness or injuries as a result of work accidents, being hit by cars, certainly violence, if they are cut in their kitchens. These things can happen. So it's not just violent injuries. Any injury where you have bleeding can result, can use these techniques. Okay, so the goals of this program are, number one, to identify what does life-threatening bleeding look like, so that we can recognize that that's the kind of thing we need to intervene on, and how can we do that safely. Second is to actually stop the bleeding. There's 3 techniques we'll be learning. Number 1 is pressure, number 2 is packing, and number 3 is placement of tourniquets. So there's 2 slides about personal safety. Your personal safety is your first priority, because if you're injured, you can't help somebody else. And if you're injured, then we have 2 people who are in a bad situation and need to be helped rather than just the one. Also, you want to make sure that it is safe for you to go into a situation. Don't go running in and start helping somebody if you could be injured as well. For instance, if somebody is in the middle of the street and needing your help, you need to make sure that the traffic has been stopped before you go in and help that person. If the situation changes and starts becoming a danger to yourself while you're trying to help, you need to stop, get yourself to safety, bring a person who you are helping with you if possible, but again, we want to minimize the number of people who are injured anywhere. Additionally, it's important for you to protect yourself. Of course, we're in the middle of this COVID pandemic right now, so we're all learning about how we need to protect ourselves. Similarly, if in a situation where somebody might be bleeding, you want to get some distance between you want to have distance between yourself and somebody else's blood. There's a couple of different ways of doing that. If you have rubber gloves, non-porous gloves, use those. If you don't have those, you can just make sure that you're using something that is watertight. You can use a plastic bag. You can use over your hand, or some newspaper, separating yourself from somebody else's blood by using a bunch of newspaper or something like that. If you do get blood on you, you want to make sure that you wash that part very well with soap and water immediately, as soon as you can. Also, once the healthcare providers, the first responders, if they're paramedics, or if you get this person to the hospital, if you have been exposed to somebody's blood, you tell them, I've been exposed, and there's testing that can be done. They can draw samples of blood from the person who was doing the bleeding, and then they can make sure that they can check to see if they have any illnesses. There are some medications that you can take if you have been exposed to somebody who has a bloodborne illness. Okay, so the ABCs of bleeding control are: number one, alert 911. I used to give this talk. I used to give talks to young children about how to get help, and that's an important thing. You need to get the people there who are going to get that person to the definitive care, meaning the hospital, where the bleeding can really be stopped for real. So alert 911, get that started early. Number two is identify the bleeding. Is it too much, and where is it happening? And then C, apply compression by one of the techniques that we are going to talk about, either by pressure, packing, or tourniquet placement. So 911, dial on your phone. They will keep you on the line. So just go ahead, talk with them over your speaker. If you are going to be busy delivering hands-on care and can't be bothered with a phone call at that time, identify somebody standing near you. Say, you in the red shirt, call 911 and tell them where we are. That person can stay on the line, let them know, yeah, we hear the sirens, we're right next to the big tree or whatever. That's alerting 911. The 911 operator is trained to help talk you through the steps that you need to take. Number two is bleeding. This is one of the bloodier slides, but this again is not real, but it is similar to what you might see. You see here that this person has identified where the bleeding is and identified that this is significant bleeding. You want to know exactly where it's coming from, and the signs that it's pretty serious bleeding are that it's continuous, it hasn't stopped. Even if it's just oozing a lot, that can be significant. Is it large volume? Is it soaking through the clothes? Is it pooling on the ground? One of the first times I ever heard this presentation was delivered by one of the people who developed this program, and during that presentation, he said about 20 times, keep the blood inside the patient. Blood that's on the pavement is no good for anybody. Keep the blood inside the patient. He kept saying that over and over and over. This is the message we want to get through. Any blood leaving the patient is a problem. That patient needs that blood. So if we can stop any bleeding, if we can stop blood from leaving the patient, that is the most important thing. Yes, we can give people transfusions, but it's not as helpful. So very important to keep that patient's blood inside that patient by these techniques. There could be multiple places where the victim is bleeding, so go ahead and as you find them, go ahead and stop that bleeding. Then you can kind of look for other places where the person might be bleeding and address those. Clothes may be hiding life-threatening bleeding. If a patient is dying, go ahead and try to, or if they're bleeding heavily, go ahead and it might be necessary to move their clothing to identify where bleeding is happening, or to apply these techniques of pressure packing or tourniquet placement. There's a few different places that a patient might be bleeding heavily from, and we'll have different techniques based on where that location is. Oops, let me go backwards. Okay, in the arms and legs, we can actually have very heavy bleeding from these places. And we also have possible bleeding from what we call the junctional areas, the neck, armpits, groin. We can't use tourniquet techniques on those places. We would need to use either packing or direct pressure. On the arms and legs, we can use direct pressure, or we can use a tourniquet, depending on the location. And then the body, any bleeding there really needs to get to the operating room. So those are patients that need to get moved out. There's not a lot that we can do in the field or as a first responder or as a bystander to help that bleeding, although we might be able to pack that or apply pressure. So we have alerted 911. We've found the source of bleeding. Excuse me. And now we're going to apply pressure. We are going to apply direct pressure to the wound. We're going to use a shirt is okay. Try to use something clean, but if you don't have something real clean, then anything is okay to use. A dirty shirt is just fine. You don't need to worry about infection at this point, because once that person gets to where they're going, they will clean the wound very well. They'll scrub it, they'll use the soap, all the things that they need to use. They also will remove any tissues or any debris that might be in the wound, grass, that sort of thing. So don't worry about any of that. We need to keep the blood inside the patient. So focus on the location of bleeding. Use just enough gauze or cloth to cover that injury. It's fine to use your shirt, and apply pressure. Once you've applied the pressure, and we've got a little video that we'll be showing in just a second here about how to apply that pressure. Keep the pressure on there. Don't peek underneath. Don't lift the pressure off, because that will allow additional bleeding. It will also disrupt any clot that you might have helped form by placing the pressure. Here's the video demonstrating application of direct pressure. There's the wound. We're going to take any cloth that we can find, wad it up, and lean into it. It might be painful, but it's important to stop her up or pinch those vessels in the area. Okay, thank you. Okay, next is packing. We're actually going to stuff the packing material, whether it's a shirt or it can be Kleenex, really anything that we have on hand that will help us stop or up that bleeding. These can be used for large wounds. It's not effective on superficial or any situation where superficial pressure isn't effective. So when you have these deeper wounds, there are cut edges on either side of that wound, and what we're trying to do is tuck the packing material in there so it will stopper up those cut edges. In the example number B, you can see that we're placing pressure on top, but there can still be a lot of bleeding underneath inside there. And this is a demonstration of packing. What she's using in this video is something called QuikClot. There are kits that can be purchased. Sometimes places are placing them in next to the AEDs, those shocking devices that you see in libraries and churches and airports. These are starting to be these kits that contain packing material, and tourniquets are starting to be found in the community. So this is demonstration of packing and then application of direct pressure over that packing. Okay, so we can use compression and packing in any of the locations, the arms and legs, the neck, armpits, and groin, or on the body. The third technique is placement of a tourniquet. When we place a tourniquet, we want to place it about 2 or 3 inches above the wound, meaning closer to the body than the wound is. We shouldn't ever place these over an elbow or knee because we can't get good compression, also because we can damage the joint. Also, we want to tighten that tourniquet until the bleeding stops. That's how we know it's tight enough. The bleeding just stops. We actually get a few of these wounds every week at the hospital where I work, which is Loyola. The tourniquet, if a person has an injured extremity, the first responders, the paramedics, all have tourniquets on their rigs, or like police officers carry them in their police cars. A lot of them also have them on their uniforms. So they just take it off, they put it on the patient, or they can even put it on themselves if they become injured. And they tighten it until the bleeding stops, which really, in a lot of cases, you'll see that limb go completely gray. There is no blood left in that limb. We've cut off the circulation, and that's actually found to be much safer than allowing a patient to continue to bleed. There have been studies done, and people can have tourniquets on for hours and they don't lose their limb. I think that the literature says that they can have it up to 4 hours. What they've found also is if a patient, if a patient has had an injury and lost the limb after tourniquet placement, it's because the injury was so severe, not because the tourniquet was placed. It's important to know that you can apply the tourniquet over clothing, but you would want to make sure that you're not placing it over, like somebody got keys in their pocket or their phone in their pocket. You need to remove that before you tighten down this tourniquet. It's also important to know that tourniquets hurt. Unfortunately, we can't do the practicing on each other in this situation, but I will tell you that if you have an opportunity to practice on each other, and I hope that we do have this opportunity at some point, you will be tightening this rod. That's the actual part that really makes it tight, is the rod that we'll be twisting. You'll see that in the next little movie that we'll be showing. There will come a time where it doesn't feel tight, and then all of a sudden it feels super tight, and it hurts because you have just cut off the circulation to that limb. You're not doing something wrong, you're saving someone's life. The paramedics can give pain medicine, or the hospital can give pain medicine to ease that discomfort of having that tourniquet on, but it's better that somebody try to be suffering that pain rather than be suffering death. A second tourniquet may be required to stop the bleeding completely. If you think about somebody who has a very large limb, like a very large leg, it's hard to get that tourniquet, that first tourniquet, tightened down tightly enough. So you may need to tighten down a first tourniquet and then place a second tourniquet and make it even tighter. Here's the movie that demonstrates tourniquet placement. This is a Velcro strap with buckles, and that rod is called a windlass rod. It's connected to a ribbon that runs the length of this, so they are making the Velcro closure tight. And now we are twisting this, and this is where you really get the compression, is the twisting of that thing. And then you want to tuck it underneath this little collar. Close that, the rest of the strap up the rest of the way, because that can get dislodged in moving a patient. And then there's this little strap, the white strap. You can write on there what time the tourniquet was placed. In the hospital, we like to know how long has this tourniquet been on. Thank you. Okay. So that's how to place a tourniquet. And yes, that tourniquet needs to be really tight until you really have no bleeding. Arterial bleeding is going to require more pressure than venous bleeding, but you don't need to worry about, is this arterial or is this venous? Just place pressure until no more blood is flowing from the wound. Okay, I'm having trouble getting it to go to the next slide. Okay, here we go. These are some different types of tourniquets. They basically have a lot of the same components to them: Velcro strap, a buckle, and a windlass rod, because that windlass rod, twisting that rod is, and getting that extra tightening is really the thing that's going to get the tightening all the way down where it needs to be. People ask a lot of times, can we use a belt? It's hard to get a belt tight enough and then to keep it clamped down at that amount of tightness. Also, you can't further tighten it. Something I tell folks is, if you've got, let's say, a necktie, something that isn't stretchy, that you can actually tighten down and then twist so that you get it really tight, that's a possibility. But these commercially available tourniquets are best. Some names of some. You can actually purchase tourniquets. They're about $30 on Amazon for a good one. Bleeding control in children. These techniques can also be used in children, although the tourniquets typically are too big for a child's limb. The good news is children usually don't have a lot of pressure behind their bleeding, and they've got those small limbs, so just using pressure techniques are usually effective for children. Okay, impaled objects. That means something that is stuck inside of somebody. If there is heavy bleeding around, say, a knife or a piece of glass, you don't want to remove that object. You just want to support that in place, and you can tuck around it if necessary. Improvised tourniquets, we talked about that. Loss of arm or leg, we talked about that. Pain, yes, and you need to be willing to be the hero and not worry about the pain. You're saving a life. You're not avoiding pain here. As far as any other questions, you can submit them to Mrs. Brennan, and I'd be glad to type up answers for you. So in summary, see to your personal safety first. Make sure that you're not going into a situation where you can become injured too. Also, make sure that you're protecting yourself from exposure to somebody else's blood. You want to call 911. That's A. B is find that bleeding. And C, apply compression with applying direct pressure, packing a wound if it's deep, or placing a tourniquet if it's on a limb or something like that. And then wait for help to arrive. When you place pressure, never ease up that pressure, because you are going to contribute to additional bleeding rather than helping. Okay, so you can find more information on stopthebleed.org. They've got a great website. They also have, you can purchase Stop the Bleed kits that contain a tourniquet, gloves, a little Sharpie marker, the packing material. The kits cost about $60. You can make one up yourself with a tourniquet that you can purchase separately. You can put these things into a baggie, put some gauze that you can get at the store, something like that. And maybe an ACE wrap to help keep the dressing in place and as you apply pressure. As they say, the only thing more tragic than a death is a death that could have been prevented. Thanks everybody for your attention. Thanks for remaining at home and stopping the spread of this virus, and hope you had a great day. Hi everyone, it's Mrs. Herlihy again. I'm here now to answer some of the questions that you had submitted to Mrs. Brennan, and she sent those to me, so I'm going to try to answer them as well as I can. You guys had great questions. I love that. I love these questions. First, some of the questions were about Stop the Bleed, so I'll answer those first. One of the questions was, how do you get trained to stop the bleed? And just taking that class or watching the video that I showed you is all that you need. Again, this class is for bystanders. It's to tell people who might be standing next to somebody or might be in a situation where you're the first person who can intervene. That's important for you to go ahead and do that if you can. So we want to teach people what they can do, specifically what they can do, and specifically who needs to be intervened on. So let's see, do you have to be a certain age to be trained? A couple of people ask that. No, you don't. Really, anybody can do this. It takes a little bit of strength, as you saw, to lean on somebody hard enough so that you can stop the bleeding. But anybody of any age can do this. Let's see, I know that for, I teach CPR, and I can tell you that at least in the CPR realm, the youngest person who has ever delivered a shock to somebody using one of those AED machines was 8 years old. And that was actually at O'Hare Airport. Somebody had a heart attack. They needed to have that technology used, one of those shocking machines. They got it from the wall and they applied it to the patient, and they were successfully able to save that person's life using that technique. So no, you don't have to be a certain age to be trained or to use these techniques. What led me to participate in Stop the Bleed, and also how many people are trained in Stop the Bleed each year? This is a fairly new program. CPR has been around for many, like decades, like 40 years, and now lots of people know how to do it. You've seen it on TV shows. You probably are aware of the technique, even if you haven't taken the class yourself. This is a fairly new one. It's only been out there for a couple, 3 years. So the equipment isn't as readily available as some of the AED equipment or the CPR equipment or knowledge is. but it's gaining traction now through classes just like this. So people are learning, I think over 1 million people have been educated on this technique so far, and are in these techniques, I should say. And we're just trying to get the word out as much as possible. Also trying to get the equipment out there as much as possible. They've made this equipment, the state of Illinois has made this equipment available, one kit, to each school in Illinois through a grant. I don't know, and then if 5 people have been trained, like completely trained with hands-on and everything, at a particular school, then they can get 5 more kits. So Mrs. Brennan has been trained. I'm not sure about your nurses, but your school nurses, but that's how that gets trained. I actually last fall gave a presentation to the teachers at Lyons Township High School in LaGrange. There were 70 teachers there who got trained in this technique, and so they were able to get extra kits. They really liked it, all the teachers did. Let's see. Next question. Here's one. How detrimental is it that bystanders understand basic medical knowledge when in a medical emergency? It is not detrimental. You're the one who's out there. If you were to start fighting with the people the next phase of people who showed up, like if the paramedics showed up and you started trying to tell them how to do their jobs, that would be detrimental. But having people know what to do who are standing right there immediately is helpful, as long as you're doing the right thing. I should mention that the Stop the Bleed techniques, if you've been educated in using them, are protected by what are called Good Samaritan laws. If you know what you're supposed to do and you do it, you can't be sued for doing it wrong or making it worse. Those are called Good Samaritan laws. It covers CPR and other things like that too. You can't be sued if somebody drops dead in front of you and you start doing CPR on them. They can't sue you for doing CPR or breaking their ribs or something like that. Those are some of the questions that. Let's see. What if you're not good under pressure and this happens? I think that one of the things that's most helpful in this situation, in any kind of a situation where it's scary, and you don't feel up to the task, is to think through it ahead of time. I do this all the time with maybe difficult conversations, or even if I've been in a situation and felt like I didn't perform my best, going over that scenario again, thinking through what I could have done, what I did do, how I could do it better next time, is a way to prepare yourself. Related to Stop the Bleed, if you imagine, okay, what if somebody at my house cut themselves very badly, or they fell through a window and they got a deep cut in their arm. What could I do? If you start thinking that through and say, okay, I could grab a towel and put pressure there and call 911, and that's how I can picture myself doing that. Then you can kind of expand from there. How would I take care of a scary situation like that? And I think that you will find, okay, there are ways that I can step up, or I can even tell somebody else, this is how you can step up, and share the burden of helping out. But I generally think that when you know what to do, especially if you've had a chance to think it through, you can respond appropriately.